I chose anesthesia because you have the ability to make a really intense connection with somebody in one of the worst days of their life. It's a really special moment that you share with them to meet them, tell them that they're going to be okay. You get them through the procedure, you support their hemodynamics, you get to do all of that in real time. And then you come up with a way to make sure they wake up without pain and nausea and feel as good as they can possibly feel after having this major traumatic event to their body and their life. So I think that's a pretty special thing. My name is Jake Schaff. I am the Chief of Cardiac Anesthesiology here at White Plains Hospital. For quite some time, White Plains Hospital has been wanting to build a cardiac surgery service. Cardiac services here, that's been around for probably around 12 years. So that's when interventional cardiology started, and you have to show a specific track record with that before the state will approve a cardiac surgery program. So once we had shown that we were able to achieve this high level of success, our cardiac surgery program was approved. So that started about 3 years ago.
I'm James Peacock. I'm an electrophysiologist at White Plains Hospital, which means I am a cardiologist that works on the electrical system of your heart. Over the last decade and a half, we've been really transformed from a community hospital to the tertiary care center of the Westchester Hudson Valley. And in order to do that, we needed to add more specialized procedures and more offerings, especially in the surgical areas where cardiac anesthesia and the rest of the anesthesia team has been really valuable.
Teamwork and collaboration are key. It's not just about having the right types of clinical skills, but it's also bringing people together from different service lines. So you do have to be a leader and someone who is charismatic to bring all people together to work together closely for something as important as this.
When we started, we all sat down and talked and said, like, what are our core values? What are our goals? Made sure that we were all very aligned in what we wanted to achieve by building this program. And really that was delivering the absolute highest quality care for patients in our community so that they could get better and get home.
When I started here 6 years ago, we didn't have a cardiac anesthesia program. We were fortunate to have Dr. Schaff join us to create that program. And in the last 5 years, we went from 1 cardiac anesthesiologist to 4. And they cover everything from our interventional cardiology, electrophysiology, cardiac surgery, and now structural heart program. So they have been instrumental in helping to grow all 4 programs.
All of these other key pieces of the cardiac service line have grown off of the presence of cardiac surgery here. So structural heart surgery, so people's valves are being replaced through small catheters in the groin. They go home the next day. Patients who come in with life-threatening arrhythmias, same thing. They come in, we evaluate their heart to make sure there's no clot, they have their ablation, they go home the next day. These are things that are like life-changing for them, and 5 years ago you couldn't do that here. You had to go into the city, you had to rent a hotel or commute 2 hours each way, and now people that live 10 minutes away have the ability to get that care right here. So it's really been transformational, I think, to the community, but having the ability to do that without having the additional stress of traveling for it and being in a place that doesn't feel familiar and in your home, I think that's a huge value that we brought to the community.
Let's face it, we're all also getting older, and many of us are going to have electrophysiology abnormalities and arrhythmias as we get older, and having the ability to fix that here at this hospital is huge for the community.
Having NAPA's resources available to us was really instrumental, because what we have is this incredibly large network of other physicians and other providers in different locations who, while they may not have done this exact thing that we are going through, they've done other hospital-wide initiatives that we could learn from.
Medicine has become so complex, and the things that we do are so complex, that the anesthesiologists are no longer just people who put a patient to sleep for us anymore. Anesthesia has gone from, ether 150 years ago to really being an integral part of what we do. I think the anesthesia field can really do anything. They get to see such a variety of different cases. They're so integral to so many different parts of the hospital and the hospital teams that they get this kind of exposure to a large breadth of medicine. So there's just a wide breadth of what cardiac anesthesia and other anesthesiologists can do these days.
It's very exciting seeing a community come together because a lot of people that we work with live right here. It's basically a group of healthcare providers, physicians, nurses, surgeons, anesthesiologists that are all working together to build this really special, unique program.